In this video, we'll discuss the pathophysiology of myocardial infarction. So what's myocardial infarction? Myocardial infarction is death of the cardiac muscle tissues resulting from ischemia that leads to necrosis and infarction. So why does it occur? It occurs due to decreased oxygen supply or increased oxygen demand. Blockade of the coronary artery or its branches is usually associated with coronary atherosclerosis and superimposed thrombus that leads to infarction. So what are the changes that occur in heart? Myocardial necrosis begins within 20 to 30 minutes and reaches its full size in 3 to 6 hours. Where does it start? Myocardial cell death begins at endocardium, an area most distal to the blood supply. And what about the gross changes and what type of necrosis occur? The gross changes occur after 12 hours and coagulative necrosis is seen after 24 hours. And after 2 weeks, the infarcted area is surrounded by granulation tissue that is replaced by scar tissue. Sudden vascular injury causes occlusion to a detached mural thrombus. What happens that sudden vascular injury causes occlusion due to a detached mural thrombus? So what substances are released and what's the role of platelet? Platelet aggregation at a site leads to release of thromboxane A2 and cyclooxygenase. Thromboxane A2 is a potent vasoconstrictor. The other substance released is glycoprotein 2B and 3A. Glycoprotein 2B and 3A have high affinity for fibrinogen, which can attach to two platelets simultaneously, causing further damage. And then coagulation cascade is activated at damaged endothelial surface. An activation of factors 7 and 10 leads to conversion of prothrombin to thrombin, which converts fibrinogen to fibrin, which forms a clot. How about the subendocardial infarction? Subendocardial infarction most commonly is due to rupture or erosion of arteriosclerotic plaque causing embolization and thrombosis. And what's culprit lesion? Culprit lesion on angiography show eccentric stenosis with scalloped or overhanging edges and a narrow neck. Angioscopy reveals white platelet-rich thrombi in subendocardial infarct, whereas in transmural infarct, angioscopy reveals red platelet-rich thrombi.